This is Mark Graybill. I'm going to talk about prevention of colorectal cancer in my presentation today. This is Mark Graybill. I'm going to talk about prevention of colorectal cancer in my presentation today. I'm presenting a 34 years old male who is overweight, inactive, and eats mostly processed carbohydrates and meat. He drinks alcohol moderately. He is already a pre-diabetic. He has a strong family of colorectal cancer. Colorectal cancer is common in the United States. It is the third leading death from cancer. The risk factors include inflammatory bowel disease, genetic predisposition, lack of physical activity, low fiber, and high fat diet, obesity, alcohol use, and smoking. The management strategy needs to be a three-pronged approach. One needs to use motivational interview skills to have a patient-centered counseling. We need to understand his motivation, understanding of the risks, and barriers to lifestyle changes. We need to understand his challenges and try to solve the issues in a manageable way for him. We can use appropriate medications to assist in his treatment, such as metformin for insulin resistance. Using the health belief model, one needs to assess the patient's understanding of the severity of this cancer. Understanding of his susceptibility to colorectal cancer, we also need to know what his barriers to lifestyle changes are so that we can address all of them. The general prevention of colorectal cancer, according to the World Health Organization, are lifestyle changes and early detection. For the lifestyle changes, one needs to manage one's weight, eat a diet high in fiber, limit alcohol intake, and stop smoking. For early detection, we can use genetic testing as a tool for patients with strong family histories to make sure they are not cancer gene carriers. Colonoscopy is also recommended to start at age 45, then every 10 years for patients with normal risk, and every 1 to 5 years for patients with high risk. The prevention plan in the current case scenario is as follows. He has a strong family history, so we should get him genetic counseling, and healthcare should prompt him for the first colonoscopy. Look at his daily carb intake and activity level, improve his diet, and add aerobic exercise. Get his family members involved to shop and cook healthier food with more fiber, less fat, less carbs, and caloric reduction. In activity, again, give him an achievable exercise regimen. Excessive alcohol intake, counsel him on the harm of alcohol, look at the emotional reasons for drinking, may need mental health counseling to get to the root of the problem, and teach him healthy coping skills. Constipation is a risk factor for colorectal cancer. High fiber diet can help improve this issue. Patient is pre-diabetic, diet change, increased exercise, metformin should address this problem. In order to achieve sustained behavior change, we recommend weekly counseling for 12 weeks to make sure the patient is on a target. We can address any challenges that may arise after 12 weeks, then follow up every 6 to 8 weeks until there is a sustained result, then every 6 months follow up afterwards.